And we're live. There we go. There you go. A lot of messing around with the audio.
Yeah, that was weird.
Huh. But we're good now. We're good now. What are all these pictures and paintings in the back?
This is my kids' playroom. It's kind of the only quiet spot if I can plug them in front of the TV for a while. So
Looking a little
just
loud in the background. What's this one with the person laying on the side? Are they
Oh,
okay?
that's a mermaid, of course.
Uh,
Clearly, yes.
what about the one next to the mermaid? That one's also a mermaid? The one with the grass and the tulips?
No, who knows? It probably is a mermaid. I don't know. A swimmer. Yeah.
They're smiling, so that's all that matters.
Yeah, I mean, it's a happy time.
As long as they're okay. How's everything going? How's your day?
Good. It was busy, but good. Just kind of running around with the kids and working on some business stuff. My
Gotcha.
day off, which is nice. How about you?
Oh, day off, huh?
Yeah.
We like those. We like those days off. You said
Yes.
running around with the kids, though?
Yeah, kids are home. They're kind of going to summer camp activities throughout the day, etc. So just driving all over.
How do you switch that on and off with your husband?
He is amazing. He is a very good partner. He's definitely not that deadbeat dad that you always hear about, people complaining. Like, he actually is my activity coordinator, I say, with the kids. So he's the one that usually knows what needs to be signed up for. He does the sign-ups. He tells me the schedule, and I go wherever he tells me. So
Wow, that's very proactive. That's great.
yes. So dads, you can do that stuff. You don't have to be the clueless dad that's not involved and doesn't know what's going on. You can take an active role, and it's really nice. We're both surgeons, so we try to just really split things up, as pretty evenly, I'd say, compared to most families. And we try to restructure our time. So we're not necessarily working the typical 8 to 5 or 6 to 5 or whatever, surgeon's hours are. Right now, for example, I work 3 days a week. He works 4 days a week this summer, but he'll usually in the school year, he'll go a little bit later, like 8:30, and drop the kids off in the morning a couple days a week and pick the kids up from school a couple hours earlier than normal. And so that just helps a lot.
So 3 days a week, 4 days a week. How is that? I'm just going to flip my view right here so that we're both facing different directions. I'm starting to do something. I'm noticing the little tweaks that I can do, like on the post on Instagram, so I can switch it. But wait, so tell me, how is that? I mean, I know a few people, but he's ENT, I thought, right? Mm-hmm. Yeah. Where'd you guys meet? How did that all come together?
We met when I was a first-year dental student and he was a second-year med student.
Oh, okay.
At church. So
at church? No way. Wait a minute. I didn't know this.
Yeah.
I didn't know that.
Very romantic story at church, He was teaching Sunday school, and I was just won over right from that moment. He had this giant mop of curly hair and spiritual giant. What can I say? He won me over.
That's amazing. Which dental school were you in at that time?
University of Iowa.
Right. Iowa. So he was in Iowa's medical school. And that's great. So were you in the medical school classes as well, or Iowa Dental School? Yeah, separate?
No, it was separate. Yeah.
I was going to say that
we
would have
took
been
a lot of
perfect.
the same classes, but not with the same teachers or at the same time.
Okay. And so you were off today. Any good cases this week?
I don't even know. I'm not one to really look that ahead on the schedule.
I hear you.
Unless there's something crazy coming up, I'll be prepared. But I'm kind of used to what's coming up, and I just don't sweat it too much, good or bad. Is that bad? I don't know.
And which days are you working if it's 3 days a week?
I usually work Tuesday, Thursday, Friday.
Nice. Okay. So today's Monday. That's why you're off today, and then you're off again Wednesday. Did you get to pick those days, or those were just the lighter days? How did it come down to Tuesday, Thursday?
I picked those days. I feel like Mondays are always terrible.
Gloomy. Nobody likes the Monday.
Back from the weekend, and it's just you get hammered with all this stuff. So if I could just skip over that day altogether. I think most oral surgeons, you probably have seen work Fridays just because people want the weekend to recover.
Yeah.
Taking Monday off is a nice way to have a 3-day weekend. And then I like having the day in the middle. It's kind of hard to be gone a really long stretch of time because patients have problems. And if you aren't in for too long a period, my nurse is bothering me all the time with patients calling me during the day. So I feel like kind of interspersing it in the middle of the week helps a lot with that.
Yeah, that's a good point. And then your husband works similar days, same days, probably different days, right?
So this summer he's taking Tuesdays off, which is nice. So we only need childcare for a couple days a week, which is really nice.
That is
this
nice.
Past school year, he was working 8:30 to 2:30. so he could drop the kids off at school and pick the kids up. So he was working every day, but on days he wasn't in the OR, he was able to pick them up. So we only had to have a babysitter 1 day a week, which was amazing.
Not bad.
Either I'd be home on Monday or Wednesday, or he'd be taking them to and from school. And so I just think we get like in our head, like about how our doctoring has to look. We have these expectations of what the profession demands on us,
Right.
and not everyone has the flexibility. Not everyone's their own boss. Not everyone has a practice where they can do what they want. But
Right.
I'm a big proponent of living your life for you. And when you're a happy doctor, you're better able to take care of your patients and your practice and to like really show up. I think we start getting that burnout when we're just like in the grind
Right.
and we're doing things the way we always thought we're supposed to do it, or the way our mentors said we had to do it, or the way the boss said to do it. I think when you can really make those decisions for yourself and like think outside the box, like, is this really how I want to work? Do I
Right.
have to work all these hours? I've had some like male doctors say to me, because I actually got illegally fired from my first job in private practice after getting pregnant. And so I made a video about it on social media, and I had some people saying like, I'd love to stay home with my kids. Well, you can. I mean, as long as it's your choice. Like, no one's forcing you to go to work. Just like, but because I'm a woman, like, well, it's good you could be forced to go home, or you could be home with the kids more. But
Yeah.
like, you as a dad could decide to do that too. Like, it's all choices. It's choices about what's your priority and how much money do you need to make, etc. And I think
Yeah.
when you really are mindful about those, we can like really take back control of our lives and hopefully make our life the way we want.
Right. Right. I think the one thing is some of the bigger organizations, DSOs, I do know of a few that like they kind of look at their least producing, least working surgeons, at least from, oral surgery
Yeah.
standpoint. I don't know enough about from the dental standpoint, although I'm sure it's even worse, but we're kind of
Yeah.
like to phase out those least producing surgeons, to phase out those least
Hmm.
producing dentists. So I think that because you own your own practice, right?
I am in a very large multi-specialty physicians group,
It's
so
multi-specialty. Yeah, yeah. But and isn't your husband kind of isn't the ENT
we're
connected?
both in the same practice. Yeah.
Yeah.
So even though I'm technically an employee, they give us a lot of free reign. Like, as long as we're pulling our weight and hitting our production, they don't really care.
Yeah, because okay, yeah, we chatted about that, and that's kind of how you were able to kind of morph and make sure that you had the schedule that you wanted. Right,
Yeah.
right. But
Yeah.
if you work for a group, sometimes that autonomy, that choice of your schedule is tough. That's why, yeah,
Yeah,
it's great in the
definitely.
position that you got.
Like,
That's
not everyone has the luxury of doing that, like your boss may dictate hours, etc. But a lot of us are our own boss, or, are in a situation where we can choose. And I think sometimes we just are so stuck in that has to be 8 to 5. Well, maybe it could be 10 to 7 or Saturday morning, or, I think there's some out of the box thinking that can be done sometime, not always, but
actually, that's a great point. I was just talking with someone today, and I want to see what your thoughts are. So I'm trying to stay away from weekends. Let's just do Monday through Friday. And I actually do want to try and get that 8 to 5. It sounds like some of the staff they don't want to work more than those hours. So they might push it 8 to 4. I really kind of want to get those extra days, 8 to 5. But you just brought up the 10 to 7. And what I wanted to try and do is make that 10 to 7 day on the Monday, and then the rest of the week, 8 to 5, 8 to 4.
mhm.
What do you think about that? It kind of allows you to maximize your weekend. And then people that need to work during the day but need to see a dentist on Monday, an oral surgeon specifically on Monday, kind of gives you them then that opportunity of those work hours afterwards. Just my thoughts. Do you have any thoughts about that? Do you think it would work, it wouldn't work?
I don't know. It's definitely an interesting thought. I've heard two thoughts. Like, I've had friends more like the dental model where they've worked later hours, and sometimes it sounds like people love it, and sometimes it sounds like hypothetically people love it. And
And they
then
don't
when it comes down to it, they don't feel like making the appointment after a long day at work or something. So, like, no shows and things like that. But especially if you're in a saturated market, I think that could be a way of, distinguishing yourself from other people.
that might be it.
Certainly people like not having to miss work. Work is time is money. So if they can come at times otherwise, but yeah, it'd be fun to try maybe.
Yeah, theoretically it would work for hopefully them and my lifestyle. So I'm hoping that works. But yeah, all right.
For
Hopefully
sure.
they let me try it because they're apparently the staff doesn't want to do any late days, and I'm like, well, wait, but the boss told me he wants a late day, so I'm trying to we're meeting in the middle here.
It's tricky when you push back against staff. They sometimes wield more power than you would like.
Yeah, and I want to work with the staff. I'm not trying to work against them. I don't know. Well,
Some of it too, you have to realize like, so you come in 8 to 5, but they have to be there early setting up and, late cleaning up and
mm,
stuff too. So maybe having like an early person and a late person can be helpful.
or that, yeah. Yeah, so that they could bring the kids to daycare or pick them up from daycare. Yeah.
Right. Maybe they can choose which works better for
I
them.
like that. I like that a lot. I like spitballing ideas like this.
What's your new practice going to be like?
He's got, I think it's 8 offices now. I worked into my
Oh,
contract. I'll be
wow.
at one office Monday through Friday, and it's 9 to 5. But like I was saying, I want to push 8 to 5. Let's work here. I'm young. I got some fresh legs,
Yeah.
and it's owned by one gentleman, and yeah, it's all private, so that's nice. And yeah,
Is there a top opportunity to buy in and become partner, or is this just going to be like associateship long term? Or
associate for 2 years. I'm gonna give everything I got. That's why I think adding on some hours, show initiative, and then we're doing the marketing for the practice now. And I need to work a lot more on the marketing because I want to work on getting implant patient leads to the practice. And right now, Facebook has not been delivering what we want it to. So that's a project that's going to be
yeah,
on the books for a while.
I
Do you do
think
anything like
implants
that?
are tricky. I think I'm in my third practice now, so I've kind of been through the transition multiple times. For me, I found it takes like a good year before you really start getting
Mm.
your implant practice going, at least in my experience. It takes a while for the dentist to get to know you and to see your work and to start trusting you enough to send something like that to you. And like, it's one thing to have a tooth taken out, it's another to have this implant that they have to restore from this strange doctor that they don't know. So building those relationships, I think, is really important. I was pretty naive at first. I feel like you're a good communicator and you're a smart guy, so you probably like figured this out already. But like, I wish I would have done a better job just like calling and following up
Oh,
and
oh,
hey, I've got this case and that you sent me, I'm really excited and I was thinking this, is that okay, or do you have any preferences, or hey, now that's restored, do you have any feedback for me, is it too palatal or too deep, or if you have anything
right.
like that, let me know. And really just letting them feel like you're that friendly guy that they can shoot off a text when they need something. I feel like that kind of relationship really helps, because are you going to want to send it to just like the dude down the street that you've heard his name, or like the
Mm.
guy that's a pretty cool, friendly guy that you're kind of friends with? I think
Always
those
there to
kind of
help.
things
Yeah.
make a big difference.
That's a great idea. Yeah. Can we get into, you said this is your third practice now. Can I hear a little bit more about your first and second? And then you mentioned a little bit of the transition period time, but can we go into the details a little bit? Can I hear the story?
Yeah. What do you want to know?
Well, what was the first place that you were at?
So I was still living in Iowa City, where the University of Iowa is.
Mhm.
And my husband was a perpetual student. He was doing MD PhD program.
Oh,
And then, so he started before me, and that's like a 7 or 8 year program just to get through school. And then he did a 5 year ENT residency and then a 1 year fellowship. So we were doing the training thing for a very long time. Pretty saturated market with the university and everyone who likes the university and wants to stay. So I was kind of coming up on graduation from residency and I had nowhere to go. Like everything I'd been looking at had fallen through. Originally, I was going to go to the university, but that didn't work out. And so I finally found a practice that was 75 miles away, where the doctor was having some back problems and it was a 2-man practice, but he needed some help. So
mm.
I ended up coming to the practice. He actually ended up having emergency back surgery, so the practice had closed. So I came and reopened that
Oh,
practice,
great, great.
and I was there by myself for a couple of years. It was really great in a lot of ways. A lot of people steer away from rural practice, but in some ways, it was amazing. Like, I just showed up. I had a full schedule from day one. I got paid very well. I paid off my student loans in the first year. Was just able to hit the ground running, full schedule every day. We didn't really have to market or advertise because, we were kind of only shop in town and within like 60-mile radius. So
Wow.
that was really a great way to just get my skills up and practice and just be able to, do what I knew how to
How
do and get my confidence up right out of the bat. So
I'm sorry, could you? How long was it? You said it closed and you reopened it. How long was that closed for? Not very long.
probably 3 or 4 months.
Oh, I thought it was going to be like 3 or 4. Weeks, months. Okay, okay,
Yeah.
but people knew where it was and everything. So opening it back up.
Yeah, well, by the time I came, everyone was really excited that I was there because they
Yeah.
needed the doctor,
Do you
So
remember? Was it a flat base salary or percentage that you like?
I had a pretty high base salary, and then if I hit that base, then it was like 30% of our collections after that.
30. Okay, okay, 30. Okay, yeah, but you crushed it. You paid off your loans in 1 year. Jesus, that's phenomenal.
Yeah. So, I mean, talk about freedom. So, like, you are probably going in the opposite situation, like being in New York, and you're probably like pretty saturated. I don't know the dynamics there,
Yeah.
but it's just interesting. I mean, a lot of people like snub their nose off of being in the rural Midwest, like when I go to the big events and where are you from? And Illinois, and everyone thinks I'm from Chicago. Like, no, not actually Chicago. And then they're kind of like, ooh. But the lifestyle that we live is really nice. It's just so much flexibility, and people are just really glad you're there. And
Yeah.
we don't have to do a lot of marketing, or I don't have to take bagels or donuts to dentists
I'm gonna have to do
much.
that.
I hear people buying like Louis Vuitton bags for referrals. Like, I
That's a
don't
good one.
do much of that.
That's a lot though. Louis Vuitton.
You're like, Louis Vuitton, good idea. And I'm like, I would never.
That's, I mean, that's a hefty price to be for your referring dentist. I mean, if
Yeah.
they see a lot of implant patients, a lot of all on X's, I would consider that. I would do that.
Yeah. I mean, maybe you got to have a rewards program, like, the frequent flyer program. You get points, and then you can get the
You
Louis
got 1,000
Vuitton.
points today.
Right.
I like that. I wonder how. Do you know of anyone that does that? I don't know anyone that does. That's
I mean, you heard it here first, folks. You heard it here first.
so. What do you? And now, that's right. The second. So then the second practice that came was. Were you just there until he kind of recovered from his back surgery, or?
No, he tried to come back, but he had too much pain. He never recovered, so he never really came back.
I don't know.
So I was there, and I recruited my own replacement, unbeknownst to me. So I tried to recruit someone else to come because it was, again, a 2.5 man practice, and I'd been there alone. I wanted to cut back a little because I just had twins,
Huh.
and I was driving 75 miles each direction. I was just hoping to cut back a little bit, and then once they hired him, they let me go as thank you for taking maternity leave, unfortunately. Oh, yeah, that was exciting. And then my next practice, I was again kind of just stuck. I'm like, I'm in this oversaturated market. I don't really have anywhere to go. I'd had a few practices that had wanted to recruit me, but the timing was just off since I was under contract before that. And by the time I was available, they didn't have spots anymore. So I remembered that a couple guys that I knew from residency who adjuncted had a satellite practice. And so I just contacted them, like, any chance you would like me to manage your satellite practice so you don't have to drive down there? And thank goodness that worked out. And that was really a good fit for that period of time.
It's pretty
So
solid. Yeah.
2 days. So I went down to 2 days a week. That's kind of all they could manage at the satellite, but then they were able to really focus on building their implant practice in Cedar Rapids, which was, a bigger market, and they didn't have to spend their time coming down there. And again, it was really busy and the patients were all lined up, and I just kind of got in and did my job. And it was an upgrade because instead of 75-mile commute, it was like a 50 mile commutes, upgrades.
A lot of miles. How far would it take you to get to a 50-mile practice or a 75-mile practice? That's at least.
I mean, luckily it was like minute per minute, like it
Yeah.
wasn't be like stuck in traffic. You just hit the road and 50 miles, 50 minutes later type of thing, you'd be there.
45 minutes one way and then over an hour for the other practice.
Yeah.
That's a long commute.
Yeah.
Working at the offices, though, which one did you kind of like better? Which one was kind of, and why?
I don't know. I mean, I loved working at both of them. I didn't have to worry about anything but doing my job. I'd show up and people were so glad I was there, and I had a great mix of patients, and the staff were all wonderful. I really liked both of them, besides like the drama from the first, but
Of course. Yeah, there's always drama in the practices, though, right? Do you have any drama where you're at now?
There's always some kind of drama. I mean, that's kind of just with the reality of working with people. It's different kinds of drama.
Yeah.
Yeah, it just was an uncomfortable situation. They were not happy that I got pregnant, nor were they happy that I took time off, etc. So, yeah, when you start getting into legal action, etc.,
Legal action
not a good
too?
situation.
It went that direction?
Yeah.
What, you got pregnant? That's allowed. I don't get it. Taking time off?
Yeah.
Wasn't that in your contract? Allowed to take time off?
Some or not, I didn't talk about maternity leave in my contract because I was too afraid to talk about it. And that's like a tricky thing. Like you should talk about it.
Mm,
100% you should talk. And I have people come to me all the time like, "Hey, what would you do?" And I'm like, "I don't know." Because really you should talk about it, right? But
yeah.
the second you bring it up, sometimes that's enough to like make people scared and don't want to hire, they get a whiff of you maybe wanting to have kids, and is
Mm,
that legal? No. Is it fair? No. Does it mean it doesn't happen? Absolutely not. It happens all the
all the
time.
time.
It's
Yeah.
happened to many of my friends. So
Mm.
I don't know. I'd love to talk to a very savvy lawyer who could talk about inserting that in there,
Mm.
in just a casual way. But yeah, so I made the purposeful choice not to ask just because I was too afraid.
Yeah. Did you have
And
an employment attorney to review the contract with?
I didn't have an employment attorney. I did have like a financial guy who does a lot of practice transitions, etc. So
Yeah. Because that might actually be the way is in the negotiating phase with between the attorneys of both parties that it might be a good attorney to attorney
right,
conversation because then you don't have to bring it up and then
right.
they have to figure that
I mean,
out and they can't
it
he's
should
gonna
just be a policy thing, right? That a business has a policy or
that could
maternity
work
leave
too.
policy is this, but I don't know. It's a scary thing to ask
Yeah, no, that's
sometimes. I mean, it shouldn't be, but
that's an essential topic because it's like what do you do? So no, I'm glad we touched that. I didn't even think of that, how hard that can be. It never got brought up on my contract, so it's like how would I know, you know?
yeah, they didn't bring that up.
No, they
They
didn't.
didn't ask that. Well, it's tricky.
They
I
were
feel
looking at
like
my
for
beer
men,
belly and
yeah, I feel like for men, like, oh, do you want to have a family? That's often looked at as a good thing, right? Like,
Hmm.
oh, he's stable, he's responsible, he's contributing to society, by, being a parent. Like, that's a great thing. But as a woman, it's a red flag. It's
Hmm.
like, oh, I don't know if she's going to be committed. And what if she doesn't want to work as much? And what happens when she takes time off? Like,
Yeah.
these are
Yeah.
all, I hate to even say red flags. That makes it, it's challenging. And as an employer myself, it's not that it's not hard. I've had people go on maternity leave or when they're nursing. Is it convenient that every day at 10:30 my assistant has to go pump? No, but it's the right thing to do. And,
Yeah.
we accommodate and make it happen. But, it's challenging, but I can see why people just want to get people the boot.
Right. Right.
It's
Right.
tempting. And I think a lot of people do, a lot more than you'd think. And I also think from an employer standpoint, you should be a little smart about it because it is a liability when you do that. The odds of you getting in trouble, I think, are low, but you could.
Right. Right. When you go to the office these days, what's the predominant procedures that you're doing? Is it dental velar? Do you do anything crazy? What's your favorite stuff to do day to day?
I'm, heavy bread and butter. I'm not doing too much. It's too crazy these days. I do a lot of biopsies for some reason. Like
Really?
so many. I don't know. I kind of feel like it's because we're on the Mississippi River and our water is probably giving us cancer or something. I don't know.
No
It's just,
way.
I remember when we first moved here and like the first 4 months, my husband and I, between the two of us, had diagnosed like 5 or 6 tongue cancers. And I remember going through all of residency and just seeing like a couple, and it was like, what in the world? There are days I do 6 or 7 biopsies in a day.
Man.
I do I'd say at least one a day, which is surprising because the University of Iowa, where university, you're drawing from the whole state, and sometimes outside you'd think you'd be seeing
Everywhere.
like the weird biopsy stuff, but I mean, every day, man, that's me, a pathology queen.
And do you do any of the benign pathology yourself? Do you bring anything to the OR? Does your husband do a lot of head and neck, or you guys send that to?
We'll do a lot of benign pathology, do a
Mm,
lot of cysts
mm.
and, excisions and things like that. My husband, he does some head and neck. He's technically pediatric, but he does do general. Sometimes if it's a big case, we'll both go together, which is just kind of fun and nice to have extra set of hands.
Yeah,
So
that's fun.
it's nice to be able to just, hey, how would you do this? Or you want to come help me cut on this guy's neck and things like that. I don't do as much anymore. So it's nice to have that
That's
extra
pretty
set of
cool.
hands. Yeah.
When's the last time you did that? What did you do?
I just did a big emeronge excision the other day on this lady. She's been draining pus out of her face for
Oh,
probably 6 to 12 months.
yeah.
And so that was one of the bigger cases I did recently where I went in and debrided that and excised the fistula from
Mm.
her cheek. And so that was kind of interesting.
You did that with him, or
I just did that by myself in the OR, but That was an interesting case because I thought I'd get in there. I thought it was sequestering off and I'd get in there and remove like a loose piece of bone, but it honestly had just like melted away. So the nerve, there was a ton of granulation tissue and I was trying
Mm.
to excise the granulation tissue and all of a sudden I was like,
Oh,
oh, that's the nerve.
no.
So all the bone around the nerve was gone, and the nerve was just completely encased in granulation tissue. And so I was trying to, work in and around, trying to get to,
Yeah.
healthy bone, trying to grind under the nerve. Like,
Yeah.
if I'd known I was like at that stage, that was like borderline, maybe resection territory, but it didn't look like it on the scan. So that was kind of fun. She's doing a lot better. Except then she's wearing her denture that doesn't fit, that has no retention at all. So now she's got a new spot, and I'm like,
Oh man.
we just did all of that.
Oh, and now
And the spot that we did surgery on is healing great, but
it is or isn't doing great.
it is,
Great.
yeah.
Okay. Okay.
But the denture, now there's a new spot, so
When you do debridement of Emrange, for example, that one you could have even potentially used oxygen for that little nerve sheathing that they have. But do you place PRP with that, or you just scoop it out, clean it out, close it up, done with it?
I didn't. We're maybe a little behind in the technology,
I mean,
Midwest and small town. So
no.
I'm not doing PRP right now, but it would be nice. I need to probably get a machine soon.
That's just one of the things we did when we could in residency. But then I don't know. I'm curious. Like, is it really advantageous? Do the patients really benefit from that over just getting everything out, closing it up? I don't know.
Yeah, sure.
I don't know.
Like it can't
That's always
hurt.
interesting. So you're going to the OR still? That's in the hospital, right?
Yeah, I go to the OR.
Yeah.
I'm always grumbly when I go to the OR. I like just being in my home, the clinic, but I hate turnover. I can't I just really can't stand OR turnover time. So it just drives me nuts every time I'm over there. Like last time I was there, I try to be on time when I get there, and then they're like, oh, your case is delayed. I just texted you. And I'm like, I'm already here. What good did that do me?
How long ago did you text me?
You texted me 10 minutes before the time to tell me, like, I should have been here by now, right? So what am I supposed to do now? So I don't know. It's kind of funny.
And then do they sometimes bring up the trace, the sterilization trace, and like their instruments missing, or you gotta...
Always.
Isn't that
That's the
so
thing,
annoying?
right? The curse of the woman surgeon, right? Is that you're like the bitchy. My husband is like the sweetest, kindest. He's like everyone's favorite. And so he's in there and they're just like, Dr. Sheffield, he's the best. And then I come in like once a month and it's like, what do you mean we're running late? And what do you mean you don't have the consent form that I have a copy of in my folder here that you're making me do a second time? How come you don't have the most like basic thing, like my elevator? Like I use that on every patient.
Where'd the periosteal go?
How come we don't have this thing? Or I asked for it 6 times 6 months ago. How come we still don't? So I'm always just like,
yeah, but where do these things go?
and I feel like they're like, how is he married to her? I'm trying to be patient and kind, but I'm just always in a pissy mood when I'm over there. So yeah,
I think that's so normal, though. That's right. I mean, it's so frustrating for us to come to the OR and they still haven't replaced this instrument we talked about 3 months ago, and then it affects the case. It affects the surgery.
Well, an assistant will be. I had an assistant literally once. I'm like, okay, I need you suctioning for me in the mouth. And before I knew it, she was standing at the feet. And to me, that was like passive aggressive, like, I'm not doing this. And I'm like, I'm not asking you to do anything crazy. I'm not throwing instruments. Like, can you just come and try, So it makes it a little hard when you don't have that support to want to go do a big case. Like,
yeah.
How am I going to do a big case where I might need you to like hold some things in place while I drill these screws in, or, when you won't even suction, or they're suctioning the throat the whole time. And you're like, can you suction? Like, I'm trying to see, like the throat pack's in there. So
the red stuff, get the red stuff.
Thanks. They're not like the awake patients. I'm glad you're sucking the back of their throat, but we don't need to worry about that right now. So it can be frustrating. The surgeons are supposed to love the OR, but I just love being in my clinic and being in charge myself. If I'm late, it's because of me.
Oh, but I would beg to differ. I would imagine that if all these surgeons on the medical side of healthcare, if they all had their own clinic and could do all these things but could do like 90-95% of things there, I'm sure they would like that too. I mean, that turnover time, like you said, is ridiculous. There was some turnover times over an hour.
Yeah.
What are we going to do? What are we going to do all this time? And it's taking time off from the office to get over there to the hospital. I just found out. So I was asking some of the doctors, the colleagues in the practice, the other associates, where are we going to get hospital privileges, right? So we do the board certification, whoop-de-doo. And apparently other states, they pay you $5,000, maybe $7,000. I think they said a month to cover the hospital for call, or a year. No, I think it's a month. And on
Mm-hmm.
Long Island, you don't get paid anything to take call. In fact, they were saying one of these hospitals, you have to pay the application every single year to be put on the board, and they don't pay you anything.
Wow.
So we're just
Mm.
constantly paying the hospitals for privileges, but
The privilege,
no,
the
yeah.
privilege to
Who's really
operate.
privileged here?
No, it's frustrating. I don't take call right now for that reason because it's for free and I want to do my duty to the community, but my husband's already taking call for free and that's disruptive enough. And
Gotta raise
how
a
do you do it with two?
family. Yeah.
Or are we both on call and then like in the middle of the night at 3 a.m. you leave the kids if it just happens? Like, what do you do? Or you have a babysitter on retainer and that's easy.
Mm,
Or we're on call not at the same time, so then we're always on call. Like it's tricky. I feel like it's outdated to expect us
it's very tricky.
to give that without being compensated, especially when other specialties are being paid.
Yeah, that too. That's yeah. It's not right. Who would go? Who would we go to for that? Would that be the Amos ABOMS committee?
And if your hospital administration is willing to play ball, you
And
might
none of
have to
them are.
play hardball. They don't, there's not much incentive unless, you as a group like offer to leave and especially if it changes their trauma status, etc. But
Yeah.
no, it's tricky. And we've been battling those same battles at home. So if you figure it out, you let me know.
Right. It's just for our end, it's a constant losing battle. So why even do? I don't know. I'm trying
Yeah,
to
that's tricky.
trying to find the solutions, trying to figure out what's right, what's
Right
exciting.
now,
But
I have courtesy privileges, so I don't take call, but I only can admit certain amount of patients per year. I honestly think if I started really using a lot, they wouldn't be too mad because business for them. At
yeah.
some point they might say it's too many and you gotta apply for regular, but I haven't really got to that point, luckily.
Right. And you were saying the assistant in the OR, so they give you an assistant when you're doing those cases in OR in the hospital,
Well,
or
just surge tech.
yeah, yeah. No, it's tough.
You can bring your own. A lot of people bring your own. Like my partner, when he goes, he brings his own assistant. But then you're paying your assistant. You're paying your assistant, and that it's
And
just,
you're not
is
getting
that
paid.
fair
Yeah.
too? Because they won't train people. You have to pay your own person to come. It's just
Right.
we don't always fit. We don't fit perfectly. We're like a square peg,
Yeah.
trying to fit in a
Everywhere we go.
circle, where no one really knows who we are, or what we do, or how to help us, or how we can help them. Education goes a long way, but that's kind of tricky sometimes to maneuver as a dentist person.
Yeah. Oh, dental. Yeah,
Yeah.
yeah, yes and no.
So do you get offended if people call you a dentist?
I don't care. Personally, I don't care because technically we came the dental route. I just explained to them, yeah, we do the surgery of dentistry.
Yeah.
I don't know. Do you get offended?
I don't get offended. I'm proud to be a dentist roots and all that. The problem I have in the hospital setting or
Yeah.
healthcare setting, I don't like to be called the dentist because it misrepresents who I am and what I'm doing. So like I walk in and the anesthesiologist is like, good, the dentist is here. And I remember I had this big osteomyelitis case. This guy had been beat up and somehow didn't get his jaw fixed for probably like 4 or 5 days. And so by then he had this festering infection and I fixed his jaw, but he got osteo on both sides. So we had to go in and we ended up doing an X fix for him just to try to get everything cleaned up. And so I'm doing, facial orthopedic surgery. Like what could be more visibly not dentistry than having like this huge pin contraption sticking out of your face, right?
Yeah, not great.
And the head of the surge techs, what don't you call him, the manager or whatever, came in and he was like, oh, the dental case. And they brought in the rheostat and the air water syringe and they're expecting me to use that,
And be like,
and I'm
thank
like,
you.
yeah, dental, so those kind of things. I don't like being called dental and that, or you bring, oh, dentistry as they roll the patient in the PACU. Like after you just did a big case like that,
Yeah.
then the nurse is just like, oh, it's just dental. And like, they aren't realizing how serious of a thing that you did to them. So
Right.
for me, it's just like an education standpoint, but no, I'm not offended. Like I know some people are, but I just think it doesn't adequately describe who we are, what we do. And I think that harms the patient sometimes.
I agree. Definitely in the hospital setting, and harms kind of that perspective of whether it be, the PACU nurses, the pre-op nurses, the other providers. Yeah. Because then they might just overlook it when it's like, no, this is actually serious. Like you do need to
Yeah.
monitor this patient. You can't just walk right by. It's not like they just had a tooth pulled. Yeah.
Right.
No, that's an excellent point.
Yeah.
Yeah. And then to get things paid for when you're doing the hospital setting and in the office, are you solely insurances? You do fee for service? What's your kind of, if I can ask, if I can know what you're doing, what you're up to?
Yeah, we take most insurance in my office. I tried to take Medicaid. I wanted to do my part, but the state of Illinois is one of the worst as
Oh,
far as payments and all of that. So I was trying to do that, and I'm probably the only oral surgeon in Illinois that was. It's like a 5 hour train ride to where I am in Quincy, and I started getting people taking the train down from Chicago thinking they're going to get their surgery and take the train home after their sedation and stuff, like, and when they sent me a 2 cent check, I was like, yeah, I can't
oh my
do
God.
this. 2 cents, like not even 2 cents on the dollar, but like 2 cents on the $100. Like and that's if you even get paid. Like it might take 3 years to get paid, and so I don't take.
You can't take it these days.
I
Oh
can't.
man.
So sometimes what I do instead, sometimes I'll find cases that I'll just donate, and that's what I choose to do
Mm,
instead of being forced to donate. Basically, I take on cases that I want to donate, but
I like
it's
that.
tricky to
Yeah.
maneuver, and yeah, we're not fee for service, unfortunately,
Yeah.
but
Yeah.
it helps patients to take their insurance, so I'm happy to do it.
That's a really good point too, to choose which cases you could do to donate rather than the whole hassle just to get nothing back. It's just a lose-lose with Medicaid. That's interesting. There's got to be a way. I don't know if that would be like a write-off or something where, sure, it's like you're donating your time to, let's take care of this patient. They need this, and their insurance is garbage. But
I wish they would give you like significant write-offs. Like it'd be a lot easier if like dollar for dollar you could just write off the cases, like okay, you're not going to get paid, but you get some write-offs. Like that might be some incentive, but I don't think it really works that way, unfortunately.
yeah, it
It's
doesn't
tricky.
it doesn't
I think
work.
it's not that we don't want to help people. I mean, like I said, a lot of us do, but we're running a business, and how do you afford? You're not only not getting paid, that's one thing, but like people don't realize, like, I'm losing money seeing you. I opened a tray and I used medications and I'm paying my staff, so
Right.
it actually costs money, and then I pay more taxes than most people, and so I'm like paying double. It's just tricky. I feel for the patients too,
Right.
but
But then, yeah, I guess the point is when it gets to it's preventing you from treating more people and seeing other people when it's because obviously we want to. That's why I like the idea where you're saying it's like you're donating. Let's take care of this patient in this case rather than worrying about the hassle of Medicaid to just get nothing in return. That's where I think all the stress, the distraction, all the time and effort, the peer to peers. That's where it really takes away from treating more patients in the future. That's a really good
yeah,
point because you can't let
definitely.
that happen. Huh? No, that's a good way to look at it.
So
Yeah.
you are taking some time off before you start, is that right?
Yeah. I'm technically off. Yeah, I'm off right now. I have this like course we're gonna use. What office like scheduling, booking, management systems do you use actually?
We run all of our charting through Epic.
Everything's through
And
Epic. Okay.
then since Epic doesn't really have a dental,
They do
we
know
use
Epic
like,
Wisdom.
do they?
Yeah,
Okay. Well, it's like $1 million, so they haven't
probably.
sprung for it for just me yet. They didn't when we first started. Oh, we're using like Windent, like this really old version that we can't update because it's so old. So yeah, I
Oh,
don't have any recommendations there.
I will in the future. Right now, I mean they're moving from OMS Vision to DSN. I don't know what's better, whatever. I've seen them both, I think, in many offices, but I don't know. It's
I think I
DSN.
was on DSN in a previous one and it was fine. Yeah.
Yeah. I don't know. I don't know. So what's going on the rest of the day? What are you doing? Are you with your kids the rest of the day too, or?
Yeah, it's about dinner time. We've got a late softball game, which is fun for little kids.
Oh, not wait. What do you mean a softball game?
Nighttime
Who you're
softball.
playing?
No, my daughter, my
Oh,
9-year-old daughter, has like a 8:30 p.m. softball game, which I just think is funny when bedtime's 7:30. So that will be fun to
eight
maneuver.
thirty. That's a late game for them. That is
Yeah, I
really
know.
late.
Yeah.
What
I
time
mean,
is
it
it
won't
where
be
you are
so
now?
hot. It's 5:30 here.
5:30. Yeah. So
Yeah.
then you got a couple hours. You usually eat dinner this early, or it's just because the game's later?
We usually eat dinner pretty early, just so we have time, get that done, and then spend some time with the kids or whatever activities running all around. And then once they're in bed, usually I'm working on my retreat business or the podcast that we're getting ready to launch.
All right. You got to tell me about this. Wait. So what retreat business? What that for that?
So last year, I launched with a couple of friends a retreat for women oral surgeons
Yes.
called the
Yes.
Elevate Summit.
That's
So
right.
It went really, really well. People loved it. Said it was life changing. It was amazing. And so I rebranded and we kind of changed our leadership, but it's going to be called The Doctor Is All In now. So just getting ready for 2.0, making everything bigger and better. Just really excited to do that. I felt like, I don't know, we met at Amos, so I hate to say anything that sounds negative about Amos at all. I usually go to the Amos meeting every year, but I go to those events and there's so many people, and I just feel like a face in the crowd, and I'm kind of like hoping no one's on to me that I'm this imposter, you know. It's like I'm just this mom, this part-time mom who lives in the middle of nowhere as far as everyone else is concerned, and I'm not putting implants in the fibula before I move it up to the face. Like, is that okay? You know, it's just, I feel like so much of it is very aspirational, but not
Mm,
really that helpful to me in my practice.
mm.
And the networking part is hard. It's hard to find people that like really feel like their story resonates with me, or that, you know, I'm like connecting with them. I don't usually meet amazing people like you. So I just wanted to create like a whole new continuing education experience where you go and you leave feeling like recharged and refreshed and inspired with new friends. You're just
Yeah.
a whole new, like, full, all intensive meeting. So that's why it's called The Doctor Is All In, because we want to like help you in all parts of who you are. So
Is
your own
this
personal wellness, your own social wellness, your practice development, etc.
why the rebrand though? Because last year it was
It was Elevate Summit. Unfortunately, after we used the name, someone decided to put it under trademark. So
wait,
that
are you
was a big
serious?
push.
Someone put on a
So
was it someone
yeah,
there at the event put on a trademark?
no, I don't know who it was. Someone completely separate. And I wasn't super sold on the name
Mm,
anyway,
mm.
so I kind of felt like we were ready for evolution and a rebrand anyway. So yeah, it's called The Doctor Is All In now.
There we go. Is it, can everyone come? Is it just women?
Well, it is just for women, unfortunately.
Okay, because the name's kind of deceiving me a little bit.
I know it's not inclusive.
It's almost all
Yeah, yeah. Well, it's about the doctor themselves as being all in, not all doctors
right,
being in.
right, right, right.
Yeah, I mean, the niche is women in oral surgery just because there's so few of us. And I think there are some extra layers of challenges
Absolutely.
being a woman. Like we already talked about some of my challenges, which are very common. I think a lot of us are moms and business owners, and all these layers of things that make it extra hard. And sometimes it's hard to find people that you can
Yeah.
rely on. You know, like I have a partner, but I don't necessarily, I always feel like I could talk to him about the
Mm.
things going on with me, you know? So just finding that support system, I think was really important. So it wasn't to leave out all of our friendly male colleagues, but more just to really lean into that niche. And I think other women, dentists or physicians or surgeons could come, and it's not like heavily academically oral surgery oriented. It's more peripheral stuff.
Mm.
So they could come, they're welcome to come if they desire, but we're really niching down for oral surgeons.
Yeah, yeah, I love that. Okay, so
Yes.
this is the new one, and you're going to have it again. When's the next event? Is it going to be at Amos, or is there
It
separate one?
is going to be in Austin, Texas at the Miraval Resort, February 27th through March 1st, 2026.
Nice. Congratulations. I didn't know that it was all set up and ready to
Oh,
go
yeah,
now.
we're launched. We're running our early bird pricing right now, $500 off. So, thedoctorisallin.org is our website if you want to check it out. If you have any questions, just let me know.
Yeah,
It's going
I
to be
love this.
amazing. It's going to be really good.
And you are going to have something at Amos too, or nothing then?
I am speaking at Amos this year again, just digitally on demand. So, I'll probably be there as well.
Great. Well, I'll see you there. All right, now tell me about the
Good.
podcast. Did that fully launch yet, or
Yes.
that's in the making?
I honestly just need to upload it and launch. Everything's set. We've already recorded like 9 episodes. It's with my friend, Dr. Sarah Harding, who is amazing.
Sarah
She's a
Harding, tell me.
veteran. She's a mom of two. She's an avocado farmer.
No
She's
way,
just really a
avocados.
lot of fun and offers some really fun insights. So we've got some really great episodes already on the docket. I just need to bite the bullet and
Harding.
get it uploaded.
DMD Sarah Harding?
Yeah,
Oh
you
yeah,
should.
here we go. Farmer surgeon. Wait, that's awesome. I love that. She should definitely put avocados in. Who doesn't like avocado? I mean, they're the little cute.
I
You know,
know.
everyone's
She
got the
lives on
little.
a farm. She's living the dream, the absolute dream.
You've done 9 episodes with her, and you haven't posted any yet.
Well, I was going to post and then we decided to launch this retreat. And so it just kind of fell on the back burner, but it's really close. It's called the Resting Stitch Face. So keep an eye out in the next couple weeks.
Great. What are you waiting for? You have 9 episodes. After you post them, you run it through ChatGPT, right? So you're using Riverside, right? It gives you the transcript.
Mm-hmm.
Use
Yep.
the stuff on the side, narrow it down so it takes out like what does it say? Find the fluff I don't do. It's where it's like remove ums and ahs, all those
Yeah,
buttons
yeah,
on the
yeah.
side. I don't use all of them, but I use, whatever you do. Then refresh because it'll cut things out in the transcript, right?
Oh, okay.
And then it'll take that out. And then copy and paste the transcript into ChatGPT, copy and paste the titles and chapters into ChatGPT, and then ask ChatGPT to extract what you want from that. Like I like to ask, what are some prominent quotes from the podcast? I like to ask what questions were asked so people can follow along. And then simplify those down to the top 10, maybe 20, and put all that, make your caption of that in like a copy and paste, template. Put on the caption, boom, make your
Nice.
thumbnail, and then you turn that into, that could take like 2 hours to do all that, right? But with ChatGPT, you can
Yeah.
get it down to like 30 minutes.
Oh, that's great. Thank you for the tip.
Yeah, boom, boom, boom. You got to get these
We'll be
9
coming.
episodes.
I mean, we'll be there a week earlier after that tip. We're ready. We just need to bite the bullet.
Yeah, by the time you post these things, it's going to be 2026.
I know. Yeah.
So,
But when we do, we're gonna be ready. Like we're already ready. I already got 9 episodes ready to go.
yeah,
So
yeah.
this is the real deal.
Do
This
you
is not
have,
us just saying.
are you going to do like one a day? You're going to do one a week? Do you know when you're going to post? Have you like,
Hopefully weekly. I haven't decided yet. Maybe Tuesdays.
I would,
When do
if you,
you? What
yeah,
do
if
you
you,
just do when you feel like it? Do you
I
have a
do whenever
schedule?
I can get to it. I post as much and as quickly as possible and
I love
just
that.
go from there. But I'm
Don't
trying to make
overthink it.
things as quality as possible. But
Yeah.
yeah, minimum one a week. That'd be great. That'd be a good time.
It's gonna be good.
Can I, when I get you on again soon, can we have Sarah too, just so I could see your
Oh, of
both you guys'
course.
dynamic and
Oh yes.
resting
That would be
stitch
fun.
faces?
I mean, we're a little cheeky. We're pretty authentic. We're not really. I would call it more a lifestyle blog. We're
Mhm.
talking more maybe like you. Like we're not talking about what's your technique for wisdom teeth as much as just talking about living life as a
Yeah.
surgeon and how crazy it is.
So
So
you do that too. I mean, because we could talk into technique of removing wisdom teeth, but it's also like you could read a textbook about that or watch all these YouTube videos.
right. I mean, after you've done it a million times, I don't really know why you have to rehash it over and
Right,
over.
right. That's we could spend 3 minutes and chat about it, but like
Yeah.
I don't know. I find other people they want to get to know you. They want to get to know Dr. Sheffield. You know what I mean? So
Yes, they do. They clearly do.
meet the person behind the mask. So well, hey, thanks for coming on today. Thanks for coming
Yeah.
on.
Thanks for having me.
This will be, I guess, technically this is part one because we had our podcast last year, but that was all
Hmm.
of us. That was Dr. Wahan. That was Dr. Jackie. So this is our part one. Nice.
Yeah. Great. Love it.
All right. Well, I'll let you get going. Hope you
Yeah.
have fun at the softball game tonight.
Thank you. Good luck with all the practice transition. I will say I am proud of you for taking time off because everyone rushes into it.
Mhm.
It's like such a habit. We're like bred to be workaholics. So everyone, it's like July 1st, you're there. And then it's like, ooh, this very awkward holiday is messing up my first week, like
Yeah.
how dare it? And we can't even like, maybe I'll just wait until July 5th. No, none of us will do that.
Yeah.
And I kind of learned now that I'm in it, I'm like, man, I would love to take a month-long vacation or just take some time to get like settled and stuff. And so I tell everyone, take some time, take some time. And they always balk at me. No, how could
You
I?
have
I
to.
could never. I've got to make all this money that I've been working so hard to try to make, or I don't know, it's just been driven into you so much and
It's
you
true.
never get this opportunity again to be able to just be free and to not have patients waiting on you or
Your
money not
bud or
being
yelling at
made
you.
or
Yeah.
bills getting accumulated and staff needing to be paid, like
Yeah.
so like take a month, take 2 months, take a couple days at least. Wait until July 7th, That's always my
Absolutely.
recommendation. No one ever, ever, ever takes that. So good job to you listening to my advice after the fact.
I mean,
You
the
figured out a
license comes in
gamble
and
even. Yeah. Well, that's a
yeah,
thing too. That's not uncommon for your license to take forever and then you're just like in limbo. Like just relax, take some time,
for the
get
first
moved
time
in if
ever.
you're moving, find yourself again, get some rest, go on a trip. You just, take some time for you. Figure out who
Yeah.
you are again because you don't know who you are probably outside of residency anymore. And it's going to take some time to figure that out.
That's a good point. That's a really good point. Oh, you got me thinking now. Who am I anymore?
Who are you? I mean, these are big, big questions.
All right, Dr. Sheffield. Thanks so much for coming on today. I appreciate
Thanks
you
for
taking the
having me.
time.
Yeah, I appreciate it. It was great to see you.
You too. You too.
Thank you.
I'll see you in the DM. I'll be chatting with
All
you in the
right.
DM.
Sounds good. Good luck to everything. I'm excited for you.
Thank you. And you too. We'll talk
Oh,
soon.
thanks. Okay.
All
Bye.
right. Bye. Good night.